There we go. We've got a couple people already starting to respond in our chat box. And what we're looking for is to get an idea about what your back pain is stopping you from being able to do. And all right. Hope you can see there. Excellent. Okay, well, I'm Alaina. I'll be guiding you through our Tour de Spine this evening. Our reason for providing these types of workshops is because our passion is helping people get out of pain naturally without medications, injections, or surgeries. So if that's what you're interested in when it comes to back pain and sciatica, then you are at the right place. All right, so I am running solo this evening, so it might take me a moment. I'll try to keep an eye on both the chat box and what we're talking about. But as we're going along, I would encourage you to put any questions along the way into the chat box. If it's something that we're going to answer in a minute or two, then I'll kind of leave it and get to that once we cover the information. But I really want this to be as focused towards the people who are here as possible. So we can take, yes, I'm going to be going through kind of our standard presentation, but if you have questions on specific types of pain or specific conditions, I'm happy to answer them. You've got me for the next hour, so I'm happy to try to help you get the most out of this as you can. So a couple of tips to help you get the most out of the workshop. I'll go ahead and tell you, you're already doing the first one now. You've gotten here. So just joining is already a big step because it means you're being proactive about your back pain and not just letting it keep going on to become a larger issue in the future. Some other things I would suggest for you to do well with for the workshop tonight is to grab a pen and paper. Go ahead and do that now. Jotting down some of these notes to yourself. Some of these, we are recording this, and depending on how it actually turns out for the audio and all of that, some of them we are going to be posting on our website so that if you want to go back through and look at some of the information we've got, we're happy to make sure you're getting access to that. But I have found that people who just take a couple of quick notes for themselves really get that information and it sticks and it helps them to better be able to take care of their back. And just as I've mentioned as well, I would go ahead into your name and whatever your pain is stopping you from doing, if you haven't done this already, into the chat box. And again, I'm going to be asking you questions along the way, and that's going to let me know as far as if you're getting the information that we need. I'll be asking you some questions about your opinions on things or what do you think is going on. And it's also a great place for you to be asking questions. At the very end of the presentation, feel free just like, hey, I'd like to chat, and I will unmute you and we can actually have more of a conversation towards the end. So let's get going. All right, so like I said, I'm Alaina Marino from Marino Physiotherapy. We are located just off of Cedar Bluff. If you know where the post office is, we're just past it on your left-hand side. So you might have seen this sign if you pass through Cross Park at any point. We're the last sign you're going to see before you hit Bridgewater. So if you're ever in the area and you feel like if you need a restroom or if you would like to stop and even just have a cup of coffee with us, stop on in and check us out. We have a beautiful facility. An average physical therapy clinic is around 1,500 to 1,800 square feet. We're 6,000 square feet. We've got lots of space to be getting a lot done. So feel free to stop and check us out at any point. I'm going to introduce one of our other physical therapists. Normally he is here helping me out with these, but he does have a family to get home this evening. So I told him, go hang out with the family and I've got this. So if I mess up on the technology side, I'll do my best to recover pretty quickly. So what we're looking at, Danny, he is an orthopedic manual therapist, the same as I am. He's been in practice since 2015. He has his degree from University of Tennessee at Chattanooga. And he actually went on, like, didn't just get his degree and say, I'm cool with that. He went on to do one of the harder certifications that's even available in the country to get his certified manual therapy. His certified manual physical therapist certification, he had to study. This is a process that usually takes about 2 to 3 years. You sit in front of a panel of experts that drill you with questions. They put a patient in front of you, and you've got to fix them on the spot. It's a pretty difficult certification, so we're really blessed to have him on board with us. He does some of these webinars as well. He'll teach some of the ones about shoulders, knees, and heel pain. So keep an eye out for those webinars as well if that's something you're interested in. I know right now we're running a limited variety of webinars just because of COVID. And doing the webinar version, but we do these in person as well. So if you have any of those you're interested in, definitely let me know. Most of the workshops we do are because patients ask us questions and they say, we want more information about fibromyalgia or heel pain or headaches or any number of topics. So if you have one of those that you're interested in, Danny and I are always happy to put these together. Again, my name is Alaina. That's my little dog Murphy sticking his tongue out in that picture there. And you might notice I have a few letters after my name. These are basically evidence of me being very blessed to work with people who are much smarter than I am. I've got 4 manual therapy certifications. I'm almost done with my 2nd doctorate. I'm in the process of writing a book about nocturnal leg cramps. So my first thesis for my fellowship was on nighttime leg cramps. I'm sorry, this book is not leg cramps. This book is pain management options for amputees. I've got a couple in the works there. But so I'm almost done with my 2nd doctorate. So I'm writing a book as part of that project. I've got 4 manual therapy certifications. I'm a board certified orthopedic specialist. And I have a 3-year fellowship it's actually 5 years, 2 years of prerequisites and 3 years of fellowship time for a fellowship in orthopedic manual therapy. And what that means, those are all fancy ways of saying I've seen a whole lot. I've gotten to work with the best of the best to learn the greatest and most efficient techniques to get people moving well. And the biggest part of that is that I do a lot of diagnostics without x-rays and MRIs. So if you go to the doctor and they're like, you need an MRI, and you're thinking, oh Lord, I got to come up with $700-800 for an MRI. I tell people, come in, let us do your assessment first, because there's so many things that an MRI won't actually tell us effectively, but we can look at something, test the tissues, ask you, is this your pain? And I'll tell you, if it walks like a duck, quacks like a duck, has little webby feet, you probably don't need a DNA test to tell you it's a duck. So I do tell, this is what all this background is I have advanced credentials and training in diagnostics without x-rays and MRIs. I'm also an adjunct faculty member for South College. And if really people ask me what I do, I tell them I'm a body mechanic because I help bodies get back together. So yeah, let's see. And yes, I'm a dog person. I have another puppy who would not hold still long enough to take a picture, so he's not in this picture. But a lot of times people ask me, Alaina, how did you get into doing these workshops and really specializing in spines? Well, spines are a little bit complex, and a lot of people get scared of treating spines because there's so many things that go on with them. And there's this fear of something that's complex if we don't see it and know exactly with x-ray vision what's going on. Spines are not as they're pretty complex, but they're not as scary and they're not as difficult to treat, especially when you have a lot of background in treating spines. So with as many people that I have come in with everything from shoulder problems, neck problems, hip problems, knee problems, foot and ankle problems, so much of the time we're having to turn around and go back to look at what is the spine doing? Is the spine contributing? And so we've started doing some of these workshops so that people get some good information about what the back is and is not supposed to be doing, and to teach you about how to take care of it. So that's how we got into presenting some of these spine workshops. Today we're going to be talking about a few different things. Back pain, I'll tell you, it's kind of a scary thing for a lot of people. So we're going to be talking about what that entails and what you should and should not be scared about. We're going to cover the #1 biggest mistake that people with back pain make when it comes to how to take care of their spines. We're going to go over a little bit of what the spine actually looks like and the 3 most common causes of spine pain or back pain or sciatica. And we're also going to talk about what the right kind of physical therapy looks like for treatment of your pain. So you might have heard, it's one of those things someone will say, oh, just do this one thing. Well, I'll tell you, if the treatment is not targeted towards the actual problem, you're probably not going to make a whole lot of progress there. So, and my chat box is frozen. So if you're asking questions, that should pull up here in just a moment. We'll give that a second. All right, I'm going to keep on going and then I will refresh this chat box if it doesn't load for me. So one of the things that we look at, I love these pictures. Here's what I want you to do as we look at these. I want you to look at that family on the left and tell me, what does that make you think of? You see, you know, a man and a woman who may be in retirement age, and they've got these two fun kids, and it looks like they're laying on the ground, and these kids are climbing all over them, and they're having a great time. Do you look at that picture and be like, yeah, I'm going to go do that right now, play with my grandkids on the ground? Or do you look at that picture and think, oh, I don't think I could get up and down from the ground that easy, or I don't think, you know, it would not feel good to have kids rolling around on my back right now. So think about that. Are you in that category where your back pain is not allowing you to do these things you want to do with the people you love? This picture in the middle, do you look at that picture and think, I would love to go on a cruise, that sounds amazing? Or do you look at this picture and you think, oh man, to go on a cruise, it means I've got to pack and carry my luggage, I've got to get it into the airport, I've got to get it up in that overhead bin, I've got to walk through the airport, I've got to sit in that plane seat for 2 or 3 hours. Do you think about all the things that your back is going to stop you from being able to do? And how do you think you'd feel by the time you got to the cruise ship? Do you think you'd feel great and ready to do a little dancing on the cruise ship? Or do you think you'd be spending your first day or two just recovering from the trip to get there? All right, and I love this picture on the right. This little man looks like he's running in some sort of race. How old do you think he is? I always like the answers I get from this one. If you'll pop that in the chat box, how old do you think this gentleman is that's running that race? Yeah. Oh, I see a couple of things from Joe and Bert. Yeah, 70 years old. That's a pretty good guess. Everything from Elva, good. So a lot of the answers I'll usually get are around 70, sometimes 80 years old. But here's what I want you to think about. Do you think this guy woke up this morning and said, I'm going to run in a race? Or do you think he prepared for it? Do you think that he made sure his body was doing what it needed to be able to do to run that race? Well, I want you to think about your day-to-day life. Is your body prepared, and is your body physically in shape enough to do the things you want to do in your day-to-day life? Whether that's running a race, playing with the grandkids, going on a trip, even just doing housework or sitting at a desk for you to get your job done. We've got to make sure that your spine is, that your whole body is well trained enough to where it can do the things you want it to do. And we have a lot of people who will say, well, I just want to go do this. Well, you wouldn't play for the Tennessee Titans and not do spring training and just hop on the field day one and start playing football. You'd make sure your body was prepared to do that activity. And what so many people don't realize is back pain robs you of doing the things you love to do. It robs you of being able to just walk around the grocery store without having to lean on the cart. It robs you from being able to hop in the car and drive 2 hours away to go see a friend or go to a campsite a little bit farther out of the way. So think of those things that you would love to do that your back pain just kind of puts the brakes on for you. And I'll tell you, people who just let their back pain keep going, they get to the point where it robs them of more and more of those things that they love to do in life. So let's talk about some ways we can avoid that and make sure you're back to living the life that you love and want. So when we look at, excuse me, there we go. All right, so when we look at back pain, it can be scary. It's not like a paper cut where you can see the cut and you think, oh, you know what? It's a paper cut. I see the cut. I know that's bleeding a little bit. I'm going to wash my hands, put some Neosporin and a Band-Aid on it. Done. It hurts, but you know exactly what's going on, so it's not really that scary. But if you think about a spine or the back, it's not like you can just turn around and look over your shoulder and see exactly what's going on. Most people have a little bit of anxiety about what you can't see. You can't just touch it and say, yep, that's the problem right there, like you can maybe a bruise. So it can be a little scary that you just can't see it. It's behind you. It's back in an area that, unless you're from the exorcist and can spin your head all the way around, most of us can't, you can't really just see what's going on with your back with your eyes. A lot of people get nervous. Am I doing some serious damage back there? Is it something that if I just keep pushing, am I going to get paralyzed? Well, the good news is low back pain most low back pain is actually below the area where the spinal cord ends. So the chances of actually getting paralyzed, not really. You can end up with some weakness in the legs, but truly being paralyzed is not a common thing for low backs. And the other thing people get scared about is not being able to participate in the life that they want and enjoy. So now that we know some of the things we get scared about, hopefully today what we're going to do is cover a lot of those things so you can understand what's going on in the spine and kind of take some of that mystery out of it so it doesn't have to be so scary. Now, let's talk about the number one biggest mistake that people make when it comes to back pain, and that's ignoring it. A lot of times people with back pain will just ignore it, and this usually comes in the form of some type of excuse, like, oh, it's just normal for my age, or oh, I'll just take an Advil or Tylenol and just tough it out, or oh, it's not that bad, I'll do something about it if it still bothers me in a couple weeks. Oh, I'll just walk it off and not really worry about it. Or a lot of people say, I don't have time to deal with this, I'm just gonna have the pain and just accept it. So that's not really something, a lot of people feel like it's an admirable thing to push through pain. When it comes to spine issues, it's better to just find out what's going on, fix the problem, and then get on with your life without all of the pain. So let's talk about some ways that we can start to do that. And I hope you have some water because it's fantastic. And as I talk some, I'm going to be grabbing water here and there. So let's talk about what people usually go through when it comes to dealing with a back problem. A lot of times people will just kind of deal with it until it gets so bad that they have to do something about it. Maybe they can't go to work, or they can't take care of their kids, or they can't even stand up straight. So what do? A lot of times they'll go to the emergency room or to their primary care physician. And at that point, your primary care physician will probably say, you know what, let's give you a little bit of pain medication and just take it easy for the rest of the week, and let's see how it feels in a week or two. And then by that point, sometimes when you come back in for another visit, they'll say, well, let's go ahead and get an x-ray and see what's going on there, which is really interesting because we have so much evidence and research that shows that x-rays and MRIs are not effective at showing us what is the cause of your back pain, unless we're looking for something more dangerous. If we suspect there's a cancer or a major fracture after a large car accident, these are not the day-to-day back pains that people get when they throw out their back, or if they just have a small, like a twist or something hurting in the back. So, but guess what? That's just kind of the way we do healthcare in the United States, as we go for that x-ray and MRI every chance we get. And if they really don't see much on that x-ray, maybe they'll say you have something called degenerative joint disease or degenerative disc disease, which is not a disease, by the way. It's just a natural part of aging. So if you're over 30 and you get an x-ray or MRI, you're probably going to see some of those changes even if you don't have any problems. So if they don't see anything specific and maybe you're still having some back pain, that primary care doc will probably send you on to the orthopedic surgeon. The orthopedic surgeon will say, well, you know, let's get an MRI and really get a good look at what's going on in there. Or let's try an injection. And I don't know if any of you have tried one of those. Let's see. I have a message about not being able to see. Carol, are you able to see what we're doing right now? Okay, I will give her a minute until we see what her response is there. Oh, for the previous pictures. Okay. So the orthopedic surgeon might look at some different pain management options, such as an injection or opioid medications. They may recommend an MRI, or they may say, you know, let's try, see how you do with maybe some physical therapy, and then we'll follow up and see about maybe doing surgery. And if you're an orthopedic surgeon, what is your best tool that you have is probably surgery. So that's just something to keep in mind as you go through this path. And a lot of times, how long do you think it takes before someone finally gets referred to physical therapy? I see all sorts of answers on this one. Okay, perfect. Thanks, Carol. So I have some people, when I ask this question, that'll say, oh, maybe it's 2 weeks before you get to physical therapy. Sometimes people are telling me maybe it's 8 to 12 months before physical therapy. Average time for people getting to physical therapy when it comes to their low back pain, just through the standard medical model, is usually closer to 4 to 6 months. So I don't know if you are excited about having pain for 4 to 6 months. I personally would not be, but we actually have a different way to do things now. And in Tennessee, Tennessee's actually a little more proactive about this than a lot of states, where in Tennessee, and we've had this since 2006, in Tennessee, if you get hurt, if you hurt your back, if you hurt your ankle or your knee, or if you have a fall and something feels like you twisted something, you don't have to go to a physician first. You can come straight into physical therapy. This is called direct access. And they set this up in Tennessee because a lot of people were going the route of ending up in the emergency rooms and getting x-rays. And we know that if you have an x-ray before you see physical therapy, your odds, an x-ray or an MRI, your odds of having surgery are increased 6 times, 7 times. I'll have to go back and look at those numbers. 6 or 7 times more likely to have a spinal surgery if you start with an x-ray or MRI. And I love this little fact at the bottom, because think of it this way. If you're more likely to have a spine surgery based on an x-ray or MRI not looking perfect, when we look across the board at x-rays and MRIs, most people who have imaging, you're going to find something wrong, just normal part of aging. You're going to find some things that don't look perfect. But most of the time, that does not correlate with what's actually causing your pain. And the interesting thing is we can actually, if the MRI says, you know what, your problem is the disc at L4-5, we can actually go to that disc, create a little pressure on it and ask you, hey, is this your pain right here? And a lot of the times it's not. What looks the worst on an MRI is not necessarily what's causing the pain, especially if you've had some of those problems for a long time and your body's found ways to compensate. So there is a high prevalence of false positives on x-rays and MRIs. And that's for people across the board. When we look at people in that 50 to 75 range, that number for, I know they did this recently with arthritis in knees, that number goes up to 97% of people who do not have any pain in their knees are going to show problems on an x-ray that are going to make you think, oh, they have really bad arthritis, this must really hurt. They did that study in people who have no knee pain. It's a normal part of aging for you to have some wear and tear in the joints, but it doesn't mean you have to be limited. It doesn't mean you have to have pain because of that. So you're probably wondering, okay, Alaina, so yeah, I should probably be looking at some physical therapy for starting to get to the root cause of my problem and getting some pain relief. But really, can my back pain get some relief? That's the question I get. You know, people ask me, I can go through all sorts of different things about backs and problems and normal spines and taking care of your posture. And the question I always get is, okay, that's all good, but what about my back pain, right? Well, here's the secret. If your pain is reproducible, okay, let's try something. I want you to stand up. I'm going to back up over here. I think you can still see me. I'm going to take my hand and put it on my hip, and I'm going to lean that way. Try leaning towards one side, and then now try leaning towards the other. Did either of those directions bring your pain on? Okay, maybe. What about if you bend forward or if you bend backwards? Do any of those directions bring your pain on? Do you notice that your pain is brought on by walking a lot? Do you notice you have more pain if you're sitting too long? Do you notice that you have more pain if you're trying to put your child into a car seat or trying to lift heavy groceries? If you have something that you can think of, like when I do this thing, it makes my pain worse, that's actually a great thing, because if your pain is reproducible, then your pain is likely reducible. Okay, let's say that again. If we can reproduce your pain, we can reduce your pain. And that's because if there's a specific motion or activity that brings your pain on, it means there's a mechanical cause to your pain that we can go in and address. So, oh, I think we already did this one. Trying leaning forward, side to side. Now, if you had a direction that was bothering you or an activity, we're going to talk about those in a little bit and go over some solutions for them. So this is a pretty complicated slide, and we're not going to go over all of it, but I want you to look at how many different things can go wrong in a spine. And some of these are just normal parts of aging. And I can't tell you how many people I know that have decided to have a surgery because someone told them that they were bone on bone, right? Bone on bone doesn't mean it has to hurt. It just means you can't get away with not having good control of the motion in your spine or at that particular joint. So just because you have wear and tear in the spine where those discs might have flattened out, it doesn't mean that you have to have pain, and it doesn't mean you have to have surgery. So I'm going to turn the slide into something a little easier to understand. All right. And here we go. Can you all see me there? All right. And, oh, Joe, I'm sorry I called you Carol earlier. I love your background with the waterfall. That's fantastic. I need to work on getting a great background at some point. All right, so what we're gonna look at, this lighting is not very good for this. Let's try, here we go. See if that helps. All right, I think that might be a little easier to see. This is a little chunk of spine, okay? If you come visit our clinic, this spine back here, his name is Skinny, this one's name is Stumpy, but this piece of spine is actually the bottom couple pieces of spine in a regular spine. So if we look at this big stack of blocks called the spine, this is part of the low back or lumbar spine. And it actually is right here, okay? So what you'll notice, you see how those little things kind of stick straight out the back? These are the parts that if you run your fingers down someone's back, you might feel those little bumpy, bony parts. So if this is the spine facing forwards, I want you to look what happens when we bend forwards and backwards. If I bend forwards, do you see how that opens this space around the nerve? Okay, so we've got this bony part. This is the vertebrae, one of the blocks of the spine. Right here is the disc. It acts sometimes as a shock absorber, but more often it acts as a spacer to keep these blocks separated. And the reason that's important is when we look in the back, do you see this spinal cord here? Right, and there's a little piece of nerve that comes off the edge of the spinal cord. Well, that nerve, as it exits the spine, it exits through this little opening. And that opening, it's not a hole, it's actually a little cave above and below. That size of the cave is going to change depending on if you're bending or forwards or backwards, okay? So when we look at this little piece of spine, and again, here's that nerve, there's a couple of things that can happen. So let's talk about what happens when you're, say, in your 20s and 30s. So if we look at this disc right here, and I'm going to tell you something, I'm going to tell you it's not exactly how the disc works, but if you think of that disc like a little jelly donut with the fibrous outer part holding the jelly in, okay? If I take a jelly donut and put it between two blocks and, let's see, if I put a jelly donut between two blocks and I squish it this way, what's going to happen to the jelly? It's going to smush out the back. So if I push the disc bending forwards, maybe twisting a bit, what's going to happen is that disc is going to push towards the back. And look what it runs into, all right? It starts bumping into that nerve. Have you ever heard of a pinched nerve? Yeah, that doesn't sound pleasant, does it? So that's one of the ways that we can have problems. Now, in reality, the disc, this is just a model. The disc doesn't just float around and move left and right. It's actually pretty stable in there. And it takes a certain degree of repetitive stress and trauma to actually create a disc bulge or to get some of that jelly to squish out a little bit. But just for you to kind of have that in mind. So if this disc is the problem, where it's bulging out the back, guess what? It's going to hurt when you do bending forward activities, or guess what else is a bending forward activity? And this one surprises people. Let's scoot on back here. Look what happens to my spine when I'm sitting, okay? Most people don't sit up nice and tall. They sit like this. When you're sitting, especially if you're back in like a lazy boy chair or a couch, and you find yourself kind of slouching forward, it might feel good at first because you're like, extra space around the nerve. But then you go try to stand up after you've been sitting for a while, and it's like, you can't stand up all the way. It's almost like you have to walk it off a little bit to finally get moving. Well, that's going to be more of a disc issue, okay? Now, so that's when we're younger. Now those discs, as we age, the disc is kind of like it's nice and plump and full of water when we're younger. And as we age, it kind of flattens out like a flat tire. So when it's nice and plump, all the ligaments that would be around here and around the joints and between the different segments, they're all nice and tight. And it's like you can do all these things and get away with it. Well, as we get older and that disc flattens, guess what? Now these blocks have a little extra motion. It's not a lot, it's like millimeters. It's not even as much as I'm showing you here. It's a small amount of extra motion. And that phase of having problems in your spine, they sometimes call it an instability. It's not really unstable. Your spine is really just a stack of blocks. So if you look at this little stack of blocks here, ooh, that's really close up. Let me back you up a little bit. If we look at a stack of blocks, if you notice, it's not perfectly stacked, but it's still very strong. So I hate that they use the phrase instability because it makes it sound like the spine's just gonna snap in half or do something crazy. Even a spine that has problems is still a very strong and stable thing, but sometimes you need a little bit of extra muscle control to give it some extra stability. So those are the people, as we start to age and you get a little more motion in the joints, those are gonna be the people who, it's like they can't stand too long, they can't sit too long. It's like, as long as they're kind of always shifting and moving around and getting in a comfortable position, they do okay. But if you ask them to do anything for too long, it's gonna start to get uncomfortable. Now, as that disc continues to flatten out, once it gets mostly flat, I want you to look at this little piece of spine again, and you see how this disc is what keeps these blocks apart. These blocks being apart is what creates space for this nerve right in here. Well, if we've worn that disc down, let's move that out of the way, you see how if there's less disc space here, you notice there's less space around the nerve right here at that opening. That is called stenosis. And I'll tell you, it's actually a very normal part of aging. Now, the key is making sure that it's not a painful part of aging. So when you have less space around the nerve, you can't get away with as much. You're going to be more likely to irritate it, or if you do have a little disc problem, there's not as much forgiveness, so to speak. And for those of you who've been around to have more than 50 birthday candles on your birthday cake, you probably know what I mean by you can't get away with as much as you could if you overdo things a little bit. So those are some of the main things that we see go on. So when we look at over here, we talk about arthritis. That's the same thing as degenerative disc disease or degenerative joint disease. Really, it's degenerative joint disease. It's just a wear and tear of what's going on. Oh, I need to share my screen. I think I'm sharing it. Okay, I warned you about technical difficulties. Let me try this again. Here we go. Sharing screen. Okay, and I think we're back. I can do some cool stuff with bodies, but being technology, sometimes we have to have a little bit of a conversation to get along. All right, so back to where we were. So when we look at things like arthritis, that's basically just another way of saying wrinkles on the inside. When we say degenerative joint or degenerative disc disease, that's a fancy way of saying you've got some wear and tear in there. And I don't know how many of you plan on making it into your 50s to 60s to 70s without getting some little laughter lines and creases here and there. But we do know that as you use your body, you're going to get some wrinkles on the inside, and that's okay. We just need to make sure that you're managing your body in a way that's going to keep things moving well and not having to hurt. Now, we talked about stenosis. That's just that's the narrowing of the space around the nerve due to some of those degenerative changes. Some people say it affects about 90% of people over the age of 50. Really where that matters is, does it actually hurt? And there's an easy way to tell if you have stenosis. We can say with more than 85% certainty that your pain is due to stenosis if you have more than 50 birthday candles on your cake. If you have pain when you're walking that feels better. If you're at the grocery store and you're walking and it bothers you and you lean forward on the cart and that helps it feel better, if you find yourself having to lean on the cart at the grocery store, I call it the grocery cart sign. That's not an official thing, but we see it across the board and there's great research out to support this. And the third thing is, if you sit down, does it feel better right away? Okay, so that's going to be that person that can't stand or walk very long. This person, that's narrowing is going to create some pain down to the legs. If your problem is more that you can't sit too long, or it hurts to bend forward, or if you try to lift a heavy load, that's going to be more of the disc problem. So there's kind of this continuum between stenosis and aging and more disc issues. And there's a lot of things in between there as well. But what's important to know there is a lot of these can cause similar symptoms. So just because your pain might be the same as, you know, your next door neighbor's, it doesn't necessarily mean it's coming from the same thing. So I want you to take a look back at Stumpy here. And do you remember these little nerves? If this nerve, if you pinch a nerve, okay, and there's lots of different ways you can irritate this nerve, but if you pinch it or irritate it, if this nerve gets irritated, the more you irritate a nerve, the farther out you feel it. So if I pinch a nerve in my neck, I might feel it up in here, or I might feel it all the way down into my hand. Some people end up with carpal tunnel diagnoses, and really it might be coming from their neck. Well, the same thing happens in the back. If you're pinching a nerve in the back, the more you irritate a nerve, the farther down towards your feet, you're going to feel symptoms. So if you pinch a nerve that happens to be one of the nerves that make up the bundle called the sciatic nerve, guess what? You might get pain in your butt and down your legs. That does not mean, now if you have that because you pinched a nerve from stenosis or because you pinched a nerve from a disc issue, it's not the same cause of the pain. So you have to look at more than just where your symptoms are. You have to look at what the underlying cause is. So that's what we're going to talk about next, is this idea of sciatica. And I'll tell you, sciatica is, I find it really funny when someone comes in and says, I have a diagnosis, I have sciatica, all right? If I went to the doctor and said, hey doc, I have this pain right here in that knee joint area, and the doctor looked at me and said, I've got it, you have knee pain, I would say, no kidding, Sherlock, I told you I have knee pain. Well, the phrase sciatica just means pain in the butt and leg. The sciatic nerve is not a nerve all by itself. In reality, you have lots of little nerves that come off of the spine, okay? And some of these nerves come together and they kind of carpool down the back up, down the buttock and back of the leg until they get down to the lower part of the leg where they split back up again and go off to their respective destinations. So when we think about the sciatic nerve, yes, technically it's the largest nerve in the body, but it's not a nerve by itself. It's several nerves that have come together and they're just carpooling. So there are a lot of different sources of things that can create problems in that sciatic nerve. It can be everything from you having a herniated disc to having some stenosis. It can be a tight muscle in your bum. It can be coming from your sacroiliac joint. It can be coming from you slipping on a water feature and landing on a rock on your bum and just hitting the nerve directly. It can come from a quick stretch to that nerve. There's a lot of different things that can cause this kind of pain, but just because you have sciatica, two people do not always treat sciatica the same way because it's not always coming from the same source. Does that make sense? So when we look at a big problem like, oh, our boat is sinking, that could come from a leak in the plumbing. It could come from a hole in the hull of the boat. It could come from the boat being the Titanic and being cracked in half. There are a lot of different causes, but you don't want to spend your time bailing water out of the boat. You want to find out what is the cause and what's the appropriate thing to do about that cause, not just about the symptoms. But if you find yourself getting pain down the back of the leg and the buttock, and it may even give you like numbness or tingling in your leg or even down to your toes. Sometimes this can lead to heel pain. This can lead to cramps in the leg. This can lead to just pain. If you're doing that inciting activity too long, the more you irritate the nerves, the farther down your leg you're going to feel that pain. But I want you to keep that in mind. Sciatica is just a fancy way of saying pain in the butt and leg. It does not tell us what the cause of the problem is. All right, so again, those top 3 causes of sciatica. So I want you to think about this, and this is something I want you to kind of look at. What part of the spectrum do you probably fall in? Are you one of those people who, if you bend forward or lift something or sit too long, does that bring on your pain? If so, you're probably working with an issue or a problem with the disc. If your problem is that you can't walk around the grocery store very long without having to lean on the cart, or that you can't walk or stand very long, if it feels better when you sit down, if you have more than 50 birthday candles on your cake, you're probably dealing with stenosis. And there are also SI joint or pelvic problems that can lead to this pain. And you may remember me talking about how the disc problem is one end of the spectrum and the stenosis is another. And then there's that middle zone where you have a little extra motion. These are all different things that can be going on. But the main ones that you want to be looking at for sciatica are if it's most like a disc problem or a stenosis problem. And it's important to tell the difference between those because the way you treat one is the opposite of the way you treat the other. Okay? And if you get it wrong, you're going to make yourself feel worse. So it's important to know that. So let's go over a couple of solutions here. Now, if your problem is the disc, let me take you off of the screen share here. Because ultimately, you're here because you want to learn how to start feeling better, right? Is anyone here because they want to learn to feel better? Yeah, Bert's got a great smile for us. Joe does too. Okay, so what we look at, oh, I lost my spot. Where am I? Okay, so here's what I want you to think about. For those of you who have pain, if you've been sitting for too long, right? Do you remember how we talked about if you maybe are sitting too long or bending forward, that disc can push out the back? Oh, there we go. And kind of give you a little bit of irritation to the nerve. Well, if we think of that disc, all right, if I bend forward and it smushes out the back, if I bend backwards too much, it's going to pinch and it's going to hurt. But if I come back little by little by little by little, I can actually start to get rid of some of that pressure on the nerve. And there's 2 ways that you can do that. Actually, there's 3. The best way is go for a walk. If you can just go for a good long walk and settle those symptoms down, perfect. That is the best way. If you're not able to do that, you can do this. This is for your back bending. This is not like a gymnastics back bend where you're trying to flip all the way over backwards. We're not doing any of that. But what you can do, put your hands on your hips. You're going to look forward and just breathe in. And as you exhale, you're going to bend backwards, but your head is not leaning back. So watch this. Do you see how I'm getting that bend in my back here? That's going to help to take some of the stress off of the disc. And the trick there is when you do those back bends, don't go so far back that you're pinching. You're just going back enough into pressure to start taking the pressure off that disc. Now, that's a symptom reliever, but that's not ultimately going to fix the whole problem. But I do want you to have some tools in your toolbox on how to start settling the symptoms. Now, if you're in that other category, more towards stenosis, well, I have a different exercise for you. And I just realized I can't do that in the chair I'm in. Let me grab a chair real quick. Okay. So if you're in the stenosis boat, one of the easiest things for you to do is just have a seat. But if you want to get a little bit of extra relief, what you can do is get your feet kind of wide apart. I tell people, imagine you're a pregnant woman and you got to have room for the belly as you bend forward. And you take your hands, put them on the inside of your thigh and drop down. Now the goal is to get your back to bend, not your hips. So this is a hip motion. This, imagine your belly staying put and you're rolling over and coming down. You can even hold your legs and give a little pull down to help out there. And what that does is that's going to take that area of your spine, especially if it's a little stiff, and it's going to open it. Oh, goodness, this little spine has been through the ringer today. It can help to, as you bend forward, open that space. It can open up these little joints in the back and take some pressure off of the nerve. Now, these are just a couple of techniques for for comfort, just to help you start to get a little bit out of pain. But here's the deal. You can't sit in a chair bent over forward all day. That's not functional. You want to get up and do the things you need to do. That's going to take a little bit of training. Sometimes you need someone to get in and actually help those joints move, because if you do that and it feel better and you never have a pain again in your life, that is awesome. I want you to have those tools. But for most people, that's going to get them relief for a little while. And then they're going to have to go back and find, okay, that only worked for a little while. I can still only walk for about 4 or 5 minutes before I have to sit down. That's when you want to have someone get in and teach you, like, okay, this is the part that needs to move better, and this is how you're going to be able to maintain that. So there's tricks to settle pain, and then there's techniques to actually fix problem. So we went over a couple of those things to be a little more specific towards treating your pain, but that's going to be kind of the kindergarten of spine care. And you want to graduate high school and be able to live a great spine life, right? Good. All right, let's go back to our presentation. Where did it go? Here we go. Okay, so those are the main causes. I think I have a picture of the SI joint in here. Oh, nope, I'm getting ahead of myself. These are some images from an MRI, and this one here on the left, let's see if I have a little pin here. Let's go with bright red. I want you to look at this picture on the left, and do you see this big bulging disc sticking out there? And it's pushing towards the back? That's actually not as scary as you would think. That doesn't feel good. What you've got to worry about there isn't the spinal cord, because if you notice up here, the spinal cord actually kind of tapers off right around there. And then from here, it's just nerves that are starting to come out the back. And you don't see those from this image just because of where it is in the cut for the imaging. But what I want you to notice is this bulge right here, and I can't find, there's several studies that do this, but I couldn't find a good clear picture on that study that I could copy and legally use. So I've got another one that looks similar to it. Look at this. So this disc bulge right here on the left, within 6 months, looked like this one on the right with no surgery. It just needed proper management. So a lot of times people see this picture on the left and they instantly think, oh my word, this looks so bad, I have to have surgery to fix it now. Your body will actually resorb that disc, and your outcomes 1 year after a surgery are exactly the same whether you had the surgery or didn't. But your outcomes at 3, 5, and 10 years are worse if you do have the surgery versus if you didn't. Now, there are a couple of exceptions to this. If you have numbness in the area where you wipe going to the bathroom, if you, all of a sudden, you hurt your back and then you have no control of your bladder, that's an emergency situation. I've never had anyone say, Alaina, I'd love to use poise pads the rest of my life. No, those nerves at the very bottom, the only nerves you're really going to get there at the very bottom, besides some that cause pain, they can affect the nerves to your pelvic floor. And that's a part of your body you definitely want to work well for the rest of your life. So that's the one exception to these when we see that happening. But if you are able to hold your bladder, then you want to avoid the surgery and start doing the things to actually take the pressure off the disc and help that heal up. And this picture on the right-hand side over here, what I want you to notice on the right, it's kind of, I don't know why this one's kind of pink colored, but it is. Do you see all of these little disc bulges? Guess what? This is a normal spine. And this person, I want to say they were in their late 40s, early 50s. We expect as we age for that disc to flatten out like a flat tire, for it to bulge out. So if someone comes to me and they're like, Alaina, I had an MRI and I had 5 bulging discs. And I said, yeah, and they look at me thinking, that must mean something really bad. Guess what? That's a normal part of aging. So the trick is to get into the tissues and find out what is actually causing the pain, not just what does it look like on an X-ray or MRI. Now, this picture I put up here just to show you this. This joint right here where I'm drawing that red line, I'm not good at drawing with the mouse, sorry. But that joint, we have one on the right and one here on the left. That's your SI joint or your sacroiliac joint. And right over here, you have muscles. There's a muscle. And then you have muscles that come from up here. There's a muscle. And they all attach out to this knob on the outside of the hip. That's not a very pretty picture. But if these muscles aren't controlling aren't controlling the force when, right here's the hip joint. If you had X-ray vision, it would kind of look like that. But that hip is in the socket, so you only see part of it. But if these muscles in the hip aren't controlling things well, then the next joint that's going to take the brunt of that force is going to be this SI joint. And this is going to be, sometimes if you have pain when you stand on one leg, or if you have pain right in that dimple on one side or the other, it can be the SI joint. And there's not a lot of motion here, but there is a lot of force and a lot of tissue deformation there. So it's not uncommon, especially if you've had back pain on and off for a long time, to get some of that sacroiliac or SI joint issue. And those are kind of fun because they're super fast to treat. It's fun it's not fun that you have the pain, but it's fun when someone comes in, you check it, it's the SI joint, you show them something that takes them 20 seconds, and then all of a sudden they have no pain. These are pretty easy to take care of, but you have to get, again, to the root cause of why was that coming on. Because if you just fix the pain and you don't find out why it was problematic, then you're just going to end up, they'll be back in 2 days with the exact same pain again. So it's fun to treat those kinds of things, but we want to always get to the root cause so that we can turn that pain off. Now, I want you to take a look at this. This is just a quick little illustration of what your spine does as it ages. It doesn't age this fast. This is something that happens over years and years. But if you look at that, how it flattens out and how everything kind of squishes down, it gives you an idea how some of these changes you see may look bad, but really it's just a normal part of aging. So that's a normal aging spine there. Next, we're just scooting right along if I can get that going. So let's talk about physical therapy. And I'll tell you, with every intervention that you look at for your back, you're going to have side effects. So some of the side effects that you have to be mindful of with physical therapy is that you're in control. It's an active thing that you gauge how much you're comfortable doing. You're not risking drug reactions. I don't know anyone who's allergic to physical therapy. Physical therapy is not going to interfere with your other medications. Again, it puts you in control. And there's different types of physical therapy. So you want to make sure we have so many different tools in our tool belts. I have some people who are like, just show me what to do and I'm going to do it. I have some people who are like, I'm scared to move. Can you please turn the pain off first? What we've found is that if you turn someone's pain off first, then they can move and feel better and then do the things to prevent the pain from coming back on. If you just say, here's some exercise, go exercise. I don't have anyone pop into my clinic and say, Alaina, I want to exercise and hopefully that'll turn my pain off. When you're in a lot of pain, you want someone to turn the pain off. So again, I'm a physical therapist, so I'm biased towards physical therapy. But what we typically see people go through is looking at other options such as medications, injections, and surgeries. And a lot of times those are just things to either mask the pain or kind of clean up the symptom, but not address the problem. So I would highly encourage you to look at physical therapy first. Now, let's talk about what that looks like. And most people are surprised when I say this, but the most important part of your physical therapy is not the exercise. The most important part of physical therapy is a precise assessment of the source of your pain and the underlying factors that go hand in hand with it. Trying to treat someone based on where their pain is does you no good, because remember, with sciatica, there's so many different problems that can cause that pain. If you don't treat the correct problem, well, you're probably going to get flared up and it's probably not going to feel very good. So precisely assessing the source of your problem is going to be the key to successful and great outcomes. Next, you want someone to be able to get in and get those joints and tissues moving, to be able to get in and say, hey, Joe, is that your pain right here? Because this is where I'm feeling a problem. Is that where you're feeling a problem? Because guess what? If we're not able to reproduce your pain, we're not going to be able to most effectively turn it off. So that's why we've got to be able to get in and test each of those tissues and use the number one, the best piece of assessment tool we have is you having a conversation. Like, tell me when it hurts. Tell me where it hurts. What brings it on? Is this your pain? Does this make it feel better? Does this make it feel worse? So being able to get your hands onto that tissue is really important. And sometimes if you have pain that goes down into your leg and buttock, using a little bit of traction, and what traction does is this, it just kind of opens the space a little bit around that nerve, and that can give you some pretty good relief there. Sometimes we'll be using traction. It really depends on what the cause of your problem is, if we decide to do that or not. And finally, once we get the pain turning down, we teach you about how to retrain your body. Okay, now you're going to move this way. Let's just do a little waking up for a couple of these muscles. Let's turn these muscles off and tell them to chill out. They're doing too much work. Let's get that proper balance and proper stabilization across all of the areas that you need it. Again, we don't just exercise everything. If we're very precise with the problem, we can be very precise with the treatment. So those of you who've been in my clinic before have probably seen one of those little handouts that says pain-free in 4 minutes a day or less. And I believe that if you are accurate with your diagnosis to know exactly which tissues are the problem, it should only take a couple of minutes a day for you to treat those tissues. And then from there, instead of saying do an hour or two of exercise, which is great. If you love exercise, I'm a huge fan of a healthy, fit lifestyle. But most people will tell me, I'm busy, I've got things to do, I just want to get back to my life. Well, in that case, we want to teach you how to use your life to help you stay better instead of doing things in a pattern that makes you get worse. So that stabilizing, strengthening is more of a retraining, and it's got to be customized to you. So if someone looks at you and says, oh, you have back pain? Here's a handout. It's got 20 exercises on it. Do them 3 times a day for however many weeks. You might be able to get some relief with that. If you do, that's great, but we know we can be more efficient. Now, I always find this interesting. Did you know that 1 in 4 visits to your primary care physician is for back pain? And do you know how much training physicians get in managing back pain? They don't get a whole lot unless they specialize in that area. Now, your primary care doctor, it's not their job to fix everything. It's their job to be able to treat the common things they need to treat, but to refer you out for those things that you do better off with a specialist. In the case of back pain, your best specialist, hi, I'm Alaina, I'm your friendly neighborhood PT. You want to have somebody who's following you through life, keeping an eye on how your body is moving. You have a dentist, you see your dentist every 6 months, and that's just for your teeth. What about the rest of your body? So I'll tell you, when we have a patient who finishes up with therapy, we don't say you're done. We say you're independent with your program, but if anything flares up, if anything starts to feel wonky, if something just doesn't feel right, give us a call and come right back in. If in 6 months you're doing great, or 3 months, we do something called booster visits. And at 3 months, 6 months, and a year, we want to follow up and make sure the things that you're working on are continue to be moving the right way, and that you're not having a backslide before it gets to becoming painful. And we actually have a lot of patients who they come and see us every 6 months just for their checkup on how they're moving. And guess what? We can spot, hey, what's going on with this foot here? You know, have you been walking on it funny? It looks like it might give you some heel pain if you keep up the way you're moving. We show them 2 things and they can avoid it altogether. Versus, have you ever heard the expression, an ounce of prevention is worth a pound of cure? So those are great things to be keeping in mind. You get a new car every 5 to 10 years, right? But, well, some of you may have done really nice with your car and not had to get a new one. But you don't get a new body. All right, you get one body, and it's the only one you get to, it's the only one that you get to get you through life. And you might have heard people say, it's really important that you don't outlive your retirement funds. But what about your body? It's a very unfortunate thing when I see somebody who their mind is sharp as can be, but their body just as broken down. So you want to make sure that your body is fit enough and moving well enough to last you at least 10 to 15 years longer than you plan on living. Because it's better to go in your sleep one day on a body that feels good rather than to suffer and become decrepit over time. Is anyone interested in that second option? Like, I don't have anyone ever volunteer for that, by the way. No one says, Alaina, I'd love to live in one of those nursing home places. Most people say, I want to live my own life on my own terms, and I want to do what I want to do in a comfortable way as long as I want to do it. So let's talk about how to do that. So we know that if you commit the single biggest mistake, do you remember what that is? Ignoring it or toughing it out, that you're probably going to have these problems. So again, there's 3 options that you have when it comes to managing your back pain. You can ignore it. I love that little monkey that pretends that there's no problem there. You can alter it. This is usually going to come in the form of addictive medications. We know that the #1 reason for people to be prescribed opioid painkillers such as Vicodin or hydrocodone, that those are typically going to be prescribed for things like back pain. And we know that you'll have around a 1 in 4 chance of becoming addicted to that if you use it for more than 5 days. So it's unfortunate, but the very first one of these classes I did, it was actually right here. We have a big space just for doing workshops and things. And I said, does anyone know someone who has struggled with an opioid addiction? And I'll never forget the woman she was on the front, just to my left, and she raised her hand. Several people raised their hand, and she looked like she was about to start crying. And I just thought, oh my goodness, I've hit a nerve here. And she said, almost to the day, a year ago from that workshop, her son had died from a prescription opioid overdose. These are not people who are like drug dealers on the street trying to get drugs. These are good people who are trying to get back to life and trying to find solutions for their pain. And when a physician says, oh, here's something that can help you, you feel like it must be safe. Prescription medications are by prescription for a reason, because we have to be careful with how we use them. So really think twice before you look at using an opioid pain medication. Second option, so we said medications, injections. I don't know anyone who's really excited about that big, long injection needle going into their spine. The injections can help with a little bit of comfort for a little while, but that's masking the symptoms. It's not getting to the root cause of the pain. It helps with some of the inflammation, but it's not fixing those mechanical problems. And finally, surgery. And it's really unfortunate. And my mom had a back problem, and I was curious what the process was, without me intervening. So I just kind of went with her to see, like, what are they telling her to do? And they had her to a surgeon within a week who did, I hate to say it, a joke of an assessment. I wasn't going to let this man cut on my mom, and to test. And he just said, look, here's your x-ray. That's where your problem is. And see, you need to have surgery. Guess what? The nerve he pointed to for her problem was not anywhere near where her pain was. And it wasn't the nerve that even went to that body part where the pain was. She was having pain down in the calf, which was one of the lower nerves. You've got to make sure you're looking at what the cause of the problem was. And I told her, I was like, Mom, nope, we're going to fix this. You're not getting cut open. And it took us about 4 weeks. She refused to tell me about the pain, of course, family, right? For a couple of months beforehand. It took us a couple of weeks. It actually took us about a week and a half to turn the pain off, but it took us a couple of weeks to additional weeks to teach her to keep it off. And you've got to be careful. It's really unfortunate when someone has a surgery for something that looks bad on an x-ray or an MRI without making sure that that's your pain, okay? Because if you come out of a whole surgery and you still have the exact same pain, wouldn't you be pretty frustrated there? Now, of course, like I said, I'm biased towards physical therapy. I think you're going to do better instead of ignoring it, instead of pursuing medications, injections, or surgery. How about you nix all of that, get to the root cause of the problem, and handle your pain? And again, Alaina Marino of Marino Physiotherapy. I am really fortunate to be able to work with such amazing therapists. You're not going to find better credentialed or certified therapists, especially in one location, anywhere in the region. So if you're looking to get a handle on your pain and you're wondering, like, why would I choose Marino Physiotherapy? If you're ready for answers, what is causing my back pain? I want to know exactly what's going on. If you're ready to get out of pain, I know that sounds like a rhetorical question. Of course, we'd love to all be out of pain, but if you're ready to do something about getting out of pain, if you want the most efficient course of care, if you don't have an hour a day to spend working on just your back stuff, if you've got to get back in action, that's when you would choose Marino Physiotherapy. And of course, some people just want to work with the best at whatever they're working on. So if you do want to work with us, we're right here over off Cross Park Drive. Of course, it wouldn't be a workshop if we didn't have a quiz at the end, right? So here are your quiz questions. Wouldn't it be nice to fix your back pain without medications, injections, and surgery? Yeah, that's a yes. That's a rhetorical question. Now, here's the one I want you to ask yourself. Is it better to treat your back pain actively or with drugs? It seems like the drugs would be the easier way, but is it really fixing the problem? Or is it just masking it and allow you to do more damage in the process? So, of course, the answer to that is it's better to treat it actively. So you've got to ask yourself, what is it that motivates you to actually do something about your back? You know, wouldn't you like to get back to doing those things that you love? Getting back to visiting with the people you enjoy. Get back to going where you want, when you want to do it without having to think, oh, I can't go for a walk there. Is there a park bench somewhere nearby where I can sit down? Or, oh, I don't think I can lift this. Or, oh, you know, I love my nephew, but I don't want to pick him up because I'm afraid it's going to hurt my back. What is it that really motivates you to do something for yourself? And if I ask this, when I ask this about spouses, the spouse will say, I will do whatever I can to help my husband or wife out of pain. But if you ask that person who's in pain, they're not focused on themselves, they're focused on the other spouse. But think about this. Is your spouse able to get you up and down out of a floor by themselves without them getting hurt? Do you want your spouse to be held back by your not being able to participate because of your back pain? So if you won't do it for yourself, think about those around you that are counting on you to be in your tip-top shape. So if you have that in mind, what's going to motivate you, then I ask you, are you going to actually do something about it? You might not. You might decide you just want to keep ignoring it. You might decide, I'd rather try out the addictive medications or one of those painful injections, or how about one of those really expensive and often ineffective surgeries? If that's the case, well, again, it's your body. You're the one who's got to live with it. I would suggest that you get a handle on it. And if you're ready to do something about your back pain, for those of you who've been on one of our workshops, we encourage you to take advantage of one of our free consultations. If you're already a patient here, then we'll just already see you. Come on in. But if you're unsure if this is what you need, set up a time for a one-on-one conversation with me or Danny. We're going to be doing these probably this week and next week, where we have some time set up where you can come in, we meet one-on-one, we hear your story, we find out, tell me all about this back pain. And we get our hands in there and we check, what is the problem that's going on? And we tell you, here's what's likely going on. And here's what it would look like to actually fix it. So now, if you have multiple things going on, maybe it's your hip and your back. Maybe it's your knee and your hip and your back. Maybe it's your foot and your hip and your knee and your back and your neck and your headache and your shoulder. If you have more than one thing going on that you want us to look at, it's a little better to go ahead and set up an evaluation. Those are covered by insurance. But if you're just kind of curious, so the evaluation is an hour-long session. It takes about 45 minutes to an hour with a physical therapist who gets in and not only does all the things from the screen, but actually starts treating and turning off your pain. So that's the difference between a screen and a consultation, an evaluation and a consultation. So the free consultation or free screen is, we're not allowed to do treatment there because we do have to actually evaluate you fully before we start treating you. But it will give you an idea of what we do. You get to look at our nice facility. You get to meet the person you'd be working with and learn a little bit about what it would take to get you feeling better. So the questions we typically ask, I meant to tell you, if you're interested in one of those, since I'm the only person in the clinic right now, you're welcome to call and leave a voicemail because I'm going to be finishing doing this, or you can actually send a text message to this phone number. This is actually this is our main number to the clinic, but it's also our on-call line. So if it's after hours and you have something like, I've hurt my back, I'm not sure what to do about it. Should I go to the emergency room? What should I do? Send a text message to our on-call line and we can give you some guidance there. If it saves you a trip to the emergency room, that's the whole reason we have that. So any of our patients, if they have an issue after hours, they know they can always call or text us. And if I'm not at the dog park and I'm not asleep already, then I'll probably get that and get right back to you. So the common questions that people ask us, one, is it covered by insurance? Yes, your insurance covers physical therapy. We are in network with Blue Cross and Medicare and some TRICARE plans. We also file for out-of-network benefits with UHC, Aetna, Cigna, and there's another one in there, Humana, for those programs as well. So if you have questions, what I suggest is, or even if you just pop it in the chat box, then we can have, then Tracy, our front desk person, is happy to give you a call back. But whenever she gets you set up for your screen, she'll also get your insurance information and she can check your benefits for you so you know exactly what your insurance covers. Do I need, excuse me, I've been talking a lot today. Do I need a referral from a physician to come see you? In Tennessee, you do not need a referral from a physician. You can just give us a call and come right in. We do want to be in communication with your physician. So once we do your evaluation, we'll write up your report and we'll send that to your doctor so that we're all on the same page with what's going on. In case we do need to send you back to your doctor to check on something, then that way we've already established that communication. Now, can back pain happen due to old age? Guess what? Age is just the number on your driver's license. It's not a diagnosis. So just because we're getting older, we do have a higher risk of back pain because we've had more time to screw up or more time to get wear and tear. But you don't have to have pain just because you're getting older. There are things you can do about it. Same thing, can you help arthritis? Arthritis means inflammation of the joint. So you turn off the inflammation at the joint and you feel fine. That doesn't mean that you're going to look 20 years old on an x-ray again. But yes, there are a lot of things we can do. Typically, if you get into that little joint, and you do this, you get that little motion just on the spot that needs it, and then you hold it with the patient breathing. Feels kind of like we're giving you a hug there with you laying on your side. Then you have people get up. I had a gentleman today who hadn't stood up in, goodness, a year and a half. And we did just that little gentle stretching just on the one joint, stood right up, walked around and said, hey, this feels great. I wish I'd done this a year ago. And his issue was arthritis in that joint. Finally, do I need surgery? I'll tell you, typically no. The best way to find out is to get in for a consultation and have someone actually find out what is the cause of your pain. Because finding the cause of your pain is going to tell you what the appropriate course of action is. Every once in a blue moon, we have someone who, yep, surgery is what they need. I'll tell you, it's less than 5% of the time, if that. And that's when we look across shoulders, knees, ankles, heels, spines, necks, the whole shebang. Having surgery is not as common of a need as you might think based on how many people end up getting surgery. So again, we've got to look at what's the true cause of it. I hope you found this information helpful. If you would like to help us out, if you Google us if you Google us, Marino Physiotherapy, you'll see our page pop up. And there's a little place you can click on. We'd really appreciate if you left us a great Google review. Those are the things that when people are considering whether they should attend one of our workshops or not, a lot of times they're looking up our website and looking us up on Google to say, what do people say about these workshops? Is it worth going to or not? So your feedback there really helps. Exciting news, we found out this week we were nominated for Best of Knoxville with City View. So if you happen to be doing the City View voting, choose Marino Physiotherapy. It's interesting, I was nominated, Danny was nominated, and the clinic was nominated. So we're encouraging everyone to vote for the clinic as a whole. And that'd be kind of exciting to do. We've been open a little over a year. So in our first year, we were nominated for that. That was just such a privilege. And so those are some things that if you just want to help out a small business, we'd very much appreciate it. And finally, I would take advantage of your free screen. Tracy will be giving you all a call in the morning to say, hey, I know you were at the workshop. Would you like to do a free screen? What information and questions do you have? And she'll be able to help you out there. So I will leave our phone number right there at the top. And if you have any questions, go ahead and pop those into the chat box. And I will pull that up so we can be chatting with everybody. All right. So yeah, a couple of things we had on here. So Bert, you mentioned about problems with standing and walking for distances and stiffness and tightness. So something I would probably ask you about is you're probably going to fall into that stenosis category. So I hope that was some useful information for you there. I had another person mention, okay, yep, good, excellent. So if y'all don't have any other questions, then I'll let you get to your evening. And I hope you got some great information from this. And I look forward to hearing from you. Y'all take care. Okay, there we go. Have a great evening, everyone.